Good morning, Mr. Smith. I am gonna change your brief. I'll be right back. Let me go wash my hands, gather my supplies. Let me close your curtain for privacy. So I close that. I'm gonna go wash my hands and grab my supplies. Wash my hands. Very good. I'm gonna gather my supplies. Here goes your list of supplies. 2 pairs of gloves. So write it down. 1 clean brief. 7 washcloths. 2 pairs of chalks. Not 2 pairs, but 1 pair of chalks. A plastic bag. Soap. And a basin. I'm gonna grab my table. You already know that we always put our barrier. I haven't put water in my basin, so I'm gonna put my supplies right quick. Oh, add another thing to your supply list, and that is a pen. Okay, I'm gonna go grab a pen because I forgot a pen, and then I'm gonna grab water. Do I want my water cold or warm? Nice and warm for my patient. How do I test the water for warm? With the back of my wrist. Like that. I'm gonna put some water. I grab my pen or marker. Okay. Before I get started, the first thing I'm gonna do is I'm gonna time and date my brief. I know that sounds silly, but it's important that we know this is the test world, you guys. All right, we really don't do this ever in the real world when it comes to brief. When it comes to dressings, yes, but not with briefs. So hopefully, if you see a brief that hasn't been changed in 24 hours, that would be definitely something to report, right? So I'm just gonna put 219 and it's, let's just say 0700. If it was 1900, will be PM. So I have it nice and dated before I get started. Perfect. So now I'm gonna put my first set of gloves. I'm gonna raise my bed to a comfortable position so I don't hurt myself. That sounds good. Okay, Mr. Smith, I am going to get started. I'm only going to expose the area. But before I do that, let me grab our protective pad or chuck and I'm going to prepare it. The way I prepare it, I roll it on the inside. I will ask my RN observer to go on the other side to give me a hand. So would you please go on the other side for patient safety? I'm going to grab his knees and his shoulders. We're going to turn. I'm gonna put my chucks down so I can get started. I always make sure that my gown is on this side so it doesn't get tucked in underneath the patient, okay? You're gonna come up this way very slightly so I can get these chucks underneath. Perfect. Now I'm gonna expose the area. And yes, this is very embarrassing, but you will get used to taking care of people. Okay, so I have a plastic bag. This is where the brief is gonna go. According to your list, if you see it, it tells you right there, and I'll show you how to roll the brief. So you unclip it or remove it or whatever. I like to close this because they're very sticky. And as you're trying to roll it with urine, remember this is urine. There's no stool on this one. So as you're trying to, unroll it, you're going to unroll it on the inside, like that, okay? You're gonna roll it on the inside, okay? Same with this, you're gonna roll this on the inside. You're gonna roll that on the inside. And according to your sheet, you're gonna pull it from front to back. So I'm gonna pull these from front to back. You're gonna ask the patient to lift their hips so that way you can pull it. In the real world, it's easier if you turn the patient, and that way you can get the dirty brief off. But for now, see, I'm gonna hold on to the chucks, because if I pull the brief, I'm gonna pull the chucks right with it, right? So I'm holding on to the chucks, and then I'm gonna slightly, carefully pull the brief as I'm rolling it, so I can have control of it, okay? I put it in my little bag, and then I dispose of it, okay? Now I'm getting ready to clean the patient. 6 washcloths will go in the water. I have 1 for drying purposes, okay? My first one is soap, as usual. I rig it. I go 1, 2, 3, 4. First step, if you read on your sheet, is go around the head of the penis, away from the urethra on a circular motion, okay? I had a very good question. What if a patient is circumcised? Uncircumcised. If a patient is uncircumcised, you do have to pull the foreskin. Otherwise, you're not performing a good perineal care. For the purpose of it, it's gonna be a mannequin, so the mannequin will be circumcised, okay? So you're gonna go in a circular motion, head of the penis, all around. That's 1. Away from the urethra. Number 2, we're gonna clean the shaft of the penis. Again, away from the urethra. We don't wanna bring in bacteria into the urine hole or the pee hole, okay? So again, I'm gonna, away from the urethra, 1, 2, and 3, and that's it. I dispose of it. I'm going to repeat the same thing with clean water. So around the head of the penis up the shaft on one side, again and again. That's it. For the scrotal area, same concept. 1, 2, 3, 4 with soap. I'm gonna clean away. So always remember, clean to dirty. Always start clean to dirty. So I just cleaned this, obviously this is the clean part, right? So I'm gonna start here underneath the penis, and we're gonna say, I'm going to clean the scrotum, okay? So I'm cleaning the scrotum, very good. 1, gonna clean the scrotum on this side. 2, gonna give a little swish to the groins. 3, and 4, okay? Repeat the same thing with clean water. So I'm gonna do 1, 2, and then 3, and 4. 4 times. Now I'm just going to pat dry the area. I keep this one, okay? For this one, I am gonna need the patient turn so I can clean the anal area and the butt cheeks. But I'm going to be kind and cover the patient up. Can you please go on the other side to help me protect my patient from falling? I'm grabbing the knees, I'm grabbing the shoulder. I'm gonna turn the patient. If I was to do this by myself, it would be very difficult with a mannequin. Patients usually can hold on to the side rail. So, Ray, can I have you hold his shoulders for me? There you go, just like that, perfect. So same thing, I'm gonna rig these, put some soap, just 4 corners. Okay, so now I'm gonna start, should I do this way to that way, or this way to this way? Yes, so front to back, okay? So I'm gonna do 1 butt cheek, from the scrotum up, 2 butt cheeks, and then I'm gonna go in the middle. From the scrotum, up the anus, up, and then 1 more. Same place, because that's the dirtiest part, okay? So I'm gonna do the same thing with water. So we're gonna do from below the scrotum, up 1 butt cheek, below the scrotum, up butt cheek, and then middle, and again, middle. And then I have my little drying towel. I'm just pat drying And right now I'm ready to put on my brief. I'm gonna roll these this way, and I'm gonna position my brief. Positioning the brief is probably one of the most difficult skills, because a lot of people leave the brief too high up, and then when you're trying to put it in the front, it's too short. So make sure that the curve is kind of aligned right where the butt cheeks begin, okay? So that's perfect. Let's bring our patient down. Thank you, Ray. I think I'm good. Okay. So I'm gonna do the same thing on this side. I'm gonna turn them towards me, knees and shoulders. Very good. So I'm gonna finish rolling that up. I'm gonna throw that one away. Put my brief ready to be tightened. Throw that away. I'm gonna make sure that my brief is nice and sealed, so that way in case of a spillage. So then I'm gonna do this right here, and then this right here. I will cover my patient up. Is that comfortable, Mr. Smith? Very good. All right. I have dirty gloves. I'm gonna remove them with a pinch and a hook. I'm just gonna grab another set of gloves because I don't wanna cross-contaminate and touch with dirty hands my coli. I'm gonna lower your bed. So I'm just gonna pretend to lower the bed right now. So I lower the bed, sit him up comfortably. I grab my supplies. I'm gonna go dispose of my water. Throw this one away. This still has water, somewhat clean, but you already put your hands in it. So then make sure that your patient has their table, their coli within reach. Here's your water if you need anything. I'm gonna go wash my hands, and then you're done. Can you stop?